So Zika is another arbovirus that we're going to talk about. It's not as invasive as dengue, but it did spread a whole lot faster. It's a very similar virus. It again has a diameter of 50 nanometers. It's a single strand of RNA and it contains structural proteins such as the capsid proteins, your envelope proteins, your membrane proteins, and other ones for replication. Very similar symptoms to normal dengue, so it has a fever and a rash, but there's also joint pain and conjunctivitis. These are just sort of the infected symptoms. There are also like repercussions of being infected with dengue, which was seen in Rio a couple of years ago. So there was a sharp peak in infections of Zika in Rio and Brazil. About 9 months later, after this peak of infections, it was noticed that there was a lot of babies being born with microcephaly, and they were being born to women who had been infected with Zika whilst they were pregnant. It was only just by chance that they noticed this. They weren't doing an experiment. They just noticed that there was a lot of Zika infections, and then the babies born after the Zika infections had microcephaly. So microcephaly is when the head size doesn't fully develop properly in the womb, so that you don't get full brain development. This can lead to seizures, developmental delay, intellectual disability, issues with movement and balance, issues with feeding, hearing loss and vision problems. So you can see it's a very big issue for these children and the families because it's a life-changing condition, really. You can't live a normal life with it. And we also don't know how it's going to affect future babies. So how's it going to affect the mum's babies that they have in the future? They were infected with Zika whilst they were pregnant, but what happens to the babies when they have another baby in a couple of years? Are they going to have microcephaly as well? I don't know. There's also a weird fun fact about Zika is that it can be transmitted through sexual transmission. So it's got a sexual transmission mechanism. So this again was only noticed by chance. So they noticed that a lot of people that went on holiday or to work trips in Zika prominent countries, when they returned home, they got ill, but the partner got ill as well. As in the romantic partner got ill. So somehow it's transmitted from the person who went to the Zika-infected country, caught Zika, have come home, doing the business with the partner, and the partner gets it as well. Zika is also quite difficult to diagnose, so you mainly base it off the clinical features and where they've been, because it only tends to be because you can only get Zika in places where there's a Zika outbreak. So they look at if you've got flu-like symptoms and if you've been to a place where there's been a lot of Zika infections recently. Also what activities you've been doing, because obviously if you're going to be in a field, in a mosquito, if you're going to be surveying for Aedes aegypti in a Zika prominent area, you're more than likely going to get Zika. But you can also do lab diagnostics such as a whole blood count, test serum and test the plasma for the different viral nucleic acids, antigens and antibodies.